My name's Maddie and I'll be explaining the case study, talking about oxycodone and also talking about the NHSQS standards.
Hi, I'm Priscilla and I'll be doing the pathophysiology and cure of the medications.
Hi, my name's Claire. I'll be talking about tamsulosin as well as our nursing interventions which relate to Nick.
Nick is a 50-year-old Caucasian male who is Australian, however works in Singapore 9 out of 12 months. His chief complaint is that there is pain radiating from his lower abdomen towards his groin, and that this pain is ongoing and fluctuates with intensity. On a verbal pain scale, Nick rates his pain 8 out of 10. He has also stated that he's vomited twice. Nick's vital signs are blood pressure of 160/197, a pulse rate of 89 beats per minute, a rest rate of 25 breaths per minute, a temperature of 36.7 degrees, and an oxygen saturation of 98% on room air. However, Nick has stated that he has no chest pain, dyspnea, fever, or bowel and bladder dysfunction. Nick has said that he has experienced similar pain in the same area 3 years early, and this was diagnosed as kidney stones. He says he experiences pain and burning during urination and has also noted that he has a reducing ability to urinate. A urinalysis was ordered and it revealed that there was a moderate increase in specific gravity, significant hematuria, and a trace of protein. Nick's results are abnormal because his specific gravity is over 1.035. This shows that there is weight in his urine that is caused by particles other than water. Hematuria is abnormal as there is usually no blood in the urine, and this is commonly caused by medium and large-sized kidney stones. Also, a presence of protein in the urine indicates that there is kidney dysfunction, as kidney stones can cause a blockage in the urinary system, and this can explain why there is a higher trace of protein in the urine that is otherwise undetectable. Nick was referred to urology and a CT scan was obtained which revealed a calculus in the right ureter. Therefore, Nick was diagnosed with a right ureteral calculus. The doctor's orders were that 4 hourly vital signs needed to be obtained, that medications needed to be administered, and that urine needed to be collected and analysed.
The kidneys filter blood to remove extra waste and water as urine. The waste chemicals in the urine may sometimes form crystals, which eventually clump together creating stones. Kidney stones are extremely hard, rock-like crystals of different shapes and sizes. Their size can be as small as a grain of sand to as huge as a golf ball. Formation of crystals include calcium, oxalate, uric acid, and phosphate in supersaturated urine. Also, together with the deficiency of urinary stone inhibitors such as citrate, magnesium, zinc, macromolecules, and pyrophosphate. Thus, stone growth starts, which then stick to the urothelium, causing erosion, creating a nucleus for subsequent stone growth and deposition. There are 4 main types of kidney stones, the most common being calcium combined with oxalate or phosphate, struvite stones caused by urine infection, which are shaped like a horn and is large, uric acid stones which are softer than other forms of kidney stones, and cystine stones which are hereditary, rare, and look like crystals rather than stones. So what contributes to a client having kidney stones? Well, the risk factors according to Saki et al. Would be gender, which is male, which is what Nick is, hypertension, which is what Nick has as a background, history, diet high in sodium and protein, and environment factor, which is hot climate, where Nick works in Singapore, which has a tropical climate. As for the potential complications related to Nick, he has a potential risk of having an obstruction, which will then lead to sepsis, an infection if the stone does not dislodge itself. For the anti-inflammatory, it will be diclofenac. The brand name will be Voltaren. The drug class is a non-steroidal anti-inflammatory drug, NSAID. Its indication will be mild to moderate pain relief. The dosage will be oral tablets 75 to 150 mg per day or 50 mg TDS 3 times a day. Side effects will be hypertension, indigestion, nausea, vomiting, dizziness, and headache. Contraindications if the client has ever experienced anaphylactic hypersensitivity reactions to diclofenac, or if the client has a history of asthma after taking aspirin or other NSAIDs. For safety and monitoring, we as nurses will ensure that there's no drug interactions. We'll also inform the client not to crush, chew, or break the tablet, but swallow it whole, as it can cause irritation to the stomach lining when crushed and may cause faster release of medication. We'll also monitor the patient's blood pressure, as medication can cause hypertension as a side effect. For the antiemetic, we'll be using metoclopramide. The brand name will be Maxilon. The drug class will be an antiemetic. Its indication will be for vomiting. The dosage is 10 mg single dose by intramuscular or by IV over 3 minutes. The contraindications will be gastrointestinal hemorrhage, epilepsy, history of neuroleptic or metoclopramide-induced tardive dyskinesia. The side effects will be gastrointestinal disturbances, hypertension, hypersensitivity reactions. As for safety and monitoring, we will monitor the blood pressure for side effects.
The next medication that we chose was oxycodone. It's an analgesia and it's also known as OxyContin. It's an opioid pain relief drug and it's usually used for moderate to severe pain relief. There's two different types of dosages you can give. There's an immediate release, which is usually between 5 or 15 milligrams orally every 4 to 6 hours, or a controlled release, which is 10 milligrams orally every 12 hours. Some common side effects are that it can cause drowsiness, headache, dizziness, vomiting, dry mouth, loss of appetite, and it can also slow or stop breathing. Some contraindications are that if the patient has severe asthma or breathing problems or a blockage in their stomach, they usually aren't really recommended to take it. And you also can't take this medication in larger amounts or for longer than prescribed because there is a high risk of addiction. With some safety and monitoring, we need to ensure that there's no drug interactions with other narcotics, especially any over-the-counter medicine. So we need to make sure that we educate Nick on which drugs he can and can't take while on oxycodone. We need to inform him how to properly ingest it because he's not allowed to crush, chew, or break the tablet, but he needs to swallow it whole with food. And he's also not allowed to consume alcohol while this medication is prescribed. And for monitoring, we're probably going to need to monitor his respiration rate as it does cause a lower breathing rate, or it could stop it altogether. And possibly just keep an eye on his fluid inputs and outputs if it does cause excessive amounts of vomiting.
Tamsulosin, or Flomax, is an alpha blocker which relaxes the muscles in the prostate and bladder neck and is used to improve urination in men. Indications include benign hypertrophy and nephrolithiasis. Initial dose starts at 0.4 milligrams orally once a day with a maximum of 0.8 milligrams. Contradictions include any allergies to tamsulosin or other similar medications. Side effects include dizziness, drowsiness, weakness, nausea, diarrhea, headache, chest pain, abnormal ejaculation, decreased amount of semen, back pain, blurred vision, tooth problems, fever, chills, body aches, flu symptoms, runny or stuffy nose, sinus pain, sore throat, cough, sleep problems, and a decreased interest in sex. Caution with liver and kidney disease, prostate cancer, low blood pressure, and an allergy to sulfur drugs. Nursing management. Initial care planning of a patient presenting with kidney stones can be based solely on the alleviation of the presenting acute pain. As stated above, non-steroidal anti-inflammatory drugs are considered the analgesia of choice by many, with the obvious outcome of passing the calculi without the need for invasive procedures. In combination with the alpha blocker tamsulosin, our treatment plan aims to dilate the ureter, which in turn will increase the rate of passage and naturally expel the calculi. Nursing priorities and interventions during the diagnosis of acute pain will include the assessment and evaluation of other physiological and psychological factors which may be contributing to the client's perception of pain. Perception of pain can be influenced through sensory and emotional components. The potential stress of being in a new environment or needing surgery can lead to an exacerbation of pain perception. Clear communication, education, and support can be used to reduce Nick's anxiety. Evaluation of the client's response to pain. This must include its location, characteristics, onset and duration, frequency, intensity, quality, and precipitating or aggravating factors. Reassessment every hour or as pain is reported is vital in identifying any decline in the client's condition, as well as identifying any developing complications. Asking the client to rate their pain on a scale of 0 to 10. Everyone's experience of pain is subjective and can only be assessed by the person themselves. Due to this, the client's description and response to pain is of great importance and must be considered at all times. Determine lifestyle factors such as alcohol and drug abuse that may affect the client's response to analgesia. Adequate pain relief is essential in promoting comfort during the passing of a renal calculi. Monitor skin colour, temperature and vital signs that may alter during acute pain. This includes heart rate, blood pressure and rest rates. Monitoring of nonverbal cues and pain behaviours can be helpful in gaining a better understanding of a client's pain rating. This is useful where there may be cultural or developmental barriers in the way. Assist the patient to control the pain by establishing their acceptable level of pain and agreeing on pain control goals. Communication between nurse and client is essential in gaining a shared understanding of the condition, as well as developing realistic expectations of what can be achieved. Provide a peaceful and calm environment whilst educating the client on diversional therapy techniques. To promote comfort and aid in muscle tension and spasm, a warm compress can be applied. By exploring these different techniques, the client is able to apply different coping mechanisms during episodes of acute pain. Patient education. Due to Nick's history with nephrolithiasis, it can be assumed that it is the result of lifestyle choices and nutritional imbalances. Patient education is an effective preventative technique and involves education on the importance of a diet that is high in fruit and vegetables. Certain fruit and vegetables produce citrates, which increase salt solubility. High potassium content in these products promotes urinary citrate excretion. Eating less salt. Calcium competes with sodium for reabsorption in the kidneys, so the less sodium, the more calcium that is absorbed. Avoid high oxalate foods. This includes spinach, apples, nuts, chocolates, and strawberries. Excessive amounts of oxalate in your kidneys can result in the production of stones. Oxalate binds to calcium and is good in moderate amounts, but high oxalate levels should be avoided if prone to kidney stones. Encourage and educate the patient on the importance of fluids. Drinking at least 2 litres of water a day can halve the reoccurrence of kidney stones. By dilating the urine, you are reducing the concentration of harmful substances that can eventuate to kidney stones. 50% of liquid consumed a day should be water. Farrell and Dempsey recommend drinking 2 glasses of water before bed and an additional glass with every nighttime awakening to avoid the chance of concentration. It is also recommended to avoid excessive sweating and high temperature climates. Prepare and identify various learning formats that will aid in educating our patient. This can include videotapes, pamphlets, seminars, and the internet. By using different learning formats, there is a much higher chance of Nick retaining the information that has been given. It promotes independence, comfort, and an environment where the client is encouraged to learn at their own pace. Electrolyte imbalances. Due to the noticeable decrease in Nick's urine output, his recent nausea and vomiting, and the increase in fluids that he is expected to drink in the hope of increasing osmotic pressure, places him at risk of developing an electrolyte imbalance. In consideration of this, the nurse must be aware of any signs and symptoms that may indicate fluid overload or dehydration. Nursing interventions that can be applied to avoid fluid complications include daily weight and a fluid balance chart. Close monitoring of the patient's fluid input and output is vital in noticing any deficits. By measuring Nick's daily weight, we are able to gather an accurate measurement of how much fluid he is retaining. Evaluate for any symptoms of confusion, edema, and breathlessness. In the case of a fluid overload, pulmonary edema is a common secondary illness with symptoms that are easily identified. Auscultation of the lungs is important in detecting the presence of any crackles that could indicate fluid in the alveoli. As a result of inadequate oxygen perfusion, confusion and breathlessness can then occur. In the event of fluid excess, fluid restrictions and potassium-sparing diuretics may be initiated. Perform a thorough skin assessment. Observe for presence of neck veins and examine mucous membranes. Dry skin and mucous membranes, as well as flattened neck veins, will indicate whether Nick is dehydrated. If this is the case, a fluid order may need to be obtained to commence the appropriate course of intravenous fluids. Total urine output must be closely monitored. This includes colour, odour, concentration and patterns of voiding, as well as regular urine analysis tests. In the hope of passing the stone naturally, Nick will be asked to increase his fluid intake and ambulation is encouraged. With the presence of stones, there is a much higher risk of obstruction and sepsis in the urinary tract. By assessing any changes in the patient's urine output, the nurse hopes to observe when spontaneous passings of kidney stones occur, as well as any infection.
The NSQHS standards that we've chosen are Standard 3, which are preventing and controlling healthcare-associated infections, and this is because Standard 3 aims to provide governance and management systems which ensure that infection control strategies are maintained throughout healthcare providers, and its goal is to provide safe and hygienic care environments around Australia and maintain safe and appropriate antimicrobial prescribing. Standard 4 is medication safety, and it's vital that safe medication administration following the 7 rights is practiced, as medication errors accommodate higher incidence of adverse effects while in hospital. And because kidney stones require a variety of pain relief medication that can be subject to OD or addiction, it's essential that the prescription, dispensary, and administration of these drugs is followed correctly and that the patient is well educated on all their medications. And then the last standard that we chose was Standard 5, which is patient identification and procedure matching. And this is essential because before beginning any treatment, you need to ensure that it's the right patient going into the surgery and they're doing it for the right reason. And you usually do that by identifying their name, date of birth, gender, address, and their medical record number. And you just identify the correct patient, as it prevents any mismatch between patients, as it can get really hectic during those times.